Great. Thank you all for joining Learning from Aging in Place Initiatives, the second in a series of 4 webinars. As a reminder, you are not audible or visible to the presenters, but we encourage you to please ask questions using the Q&A function. This webinar is being recorded and will be posted on the Hastings Center website later today. Now I would like to turn it over to Nancy Berlinger. Dr. Berlinger is a research scholar at the Hastings Center and co-author of the Advancing Housing and Health Equity for Older Adults report.
Thank you, Ashna. Welcome, everyone. As Ashna mentioned, today's webinar is the second in a series of 4 webinars to launch a new report from the Joint Center for Housing Studies based at Harvard University and from our organization, the Hastings Center, on lessons from the COVID-19 pandemic concerning housing and community in aging societies. And we'll drop the link to the full report in the chat. Today's webinar will focus on lessons from aging in place programs and networks. We're going to talk about the place in aging in place with guests from 4 different places in the United States. And I invite our panelists to turn on their cameras and their audio. Thanks, everyone. So Alana Kiefer directs the Center for Aging based at the New York Academy of Medicine, which works to improve the health and well-being of current and future older adults in New York City. Julia Stombos directs the Aging in Place program of the Henry and Marilyn Taub Foundation in Northern New Jersey, which is part of the age-friendly North Jersey network of community-based programs supporting aging in place. Kathy Pointer directs Kingdom Care Senior Village, a membership-based aging in place program for older adults in Anacostia and adjacent neighborhoods in Southeast Washington, D.C. She has an extensive background in nonprofit management and in community-based organizations. Chris Reeder-Young directs research and policy at Habitat for Humanity of Greater Memphis. Her work as an applied anthropologist at the intersection of housing and health focuses on neighborhood revitalization, affordable home ownership, and adaptive home interventions. So, as was mentioned at the top, please place your questions in the Q&A function. We'll get to as many as we can. Jennifer Malinsky and Bailey Hugh, the co-authors of the new report, are here behind the scenes and can answer questions that are about the report. They may respond to you directly in the Q&A. And then I'll get questions for the panel as well. And I may weave some of the questions in during the way. So one way or another, we'll try to get to everything. So let's start. The first question I'd like to ask each of you, and I'm going to start with Alana, is what is aging in place? And what does your organization do to support it in the places you serve? So try to set the scene for us. We've heard of New York City, obviously, but how does aging in place happen in the nation's largest city?
Thank you. So I'm going to give you the Ilana Kiefer definition, not the Webster's definition of aging in place. But the way that I see aging in place is really living in your home and in your community for as long as physically and cognitively possible. And in New York City, it's actually a pretty good place to age in place for many reasons. Number one, most people don't have to worry about taking care of a big house, shoveling snow, driving a car, all these things that can be more challenging as people get older. A lot of those needs are already taken care of just by virtue of living in apartment buildings in a very public transit rich city and environment. And so, it's pretty well known kind of in the aging community that survey after survey shows that the vast majority of people want to age in place and age in their homes surrounded by the furniture they know, the physical space they know, the photographs they know, and the people they know. And so we work at the New York Academy of Medicine to make sure that apartment buildings and transit and social services are doing their best, and neighborhoods and sidewalks and many other areas are doing their best to make that happen for the well over 1 million older adults in the city.
Thank you. And it's interesting, that reminder of New York City's 8 million, that there's over 1 million older adults, which is the same number of children in the New York City public school system. To just give you an idea of the scale of aging in place in this city, it would be the size of a city on its own. So what is the Julius Stombos definition of aging in place, and how does it happen for your organization as a grant maker and also part of the larger network that you've helped to catalyze in Northern New Jersey?
Thank you so much, Nancy. I'm very much in agreement with Ilana on the definition. We like to think about our foundation's investments as supporting people to age in their communities for as long as possible and maintain their independence and their functionality, as Ilana said. And then at the point when they may need some supports or some other kinds of community interventions, that those would be there in an equitable way. So we're trying to help the nonprofits that we're working with to build their capacity to be able to serve in that way as the numbers of older adults grow. I guess our population in New Jersey is just a little over what the whole city of New York is. So maybe a similar number of older adults and growing. And we hope that our relationships and partnerships in the communities that we work in Northern Virginia, Bergen and Passaic counties specifically, are able to, rise to that occasion, meet those needs. And we hope that some of the foundational investments that we're making can help them do that. It's, we have sort of a rosy vision of aging in place, that everybody has access to the things they need as they age, the things that they want in their communities. And trying to reach that vision, we sort of focus on 3 areas in our grant making. To be specific, we give about $1.5 million to $2 million a year in grants for aging in place to organizations local to our communities. And we have sort of 3 buckets that we put those in. One is our Age-Friendly Community Initiative, which is continuing to grow. Another one is trying to reinforce the direct care workforce and make gerontological careers more attractive and incentivize that. And then supporting our local nonprofits to build their capacity for direct services.
Thank you. I mean, when I picture New York City and Northern New Jersey are right next to each other, but very different. And one of the differences is that you have one city versus literally dozens and dozens of suburbs. I mean, the two counties that you mentioned may have something like 100 different municipalities in them. And I know this has been very interesting. You're going to talk about it later, the networking that you've been able to do to help these programs learn from each other and be supported by what they're doing. So it's very interesting use of a grant maker's ability to bring people together. Now let's going a little further south. Let's look at Washington, D.C. Kathy, how would you define aging in place, and what does it mean if you could explain the village model and how it's applied in Anacostia and other areas of Ward 8 in Washington? And you just need to.
Yes,
good.
We definitely agree with Alana's definition and what Julia supported as well, that it is to allow seniors the opportunity to age in their homes, to stay there as long as reasonably possible through supportive services. The village model does that more on a localized community basis, that villages are local to various communities. In the DC area, we have 13 senior villages. The village movement is about 20 years old, gained quite a bit of traction during COVID because we know the members more personal, kind of one-on-one and pretty much 24-hour access for members that needed services and support is what the villages actually bring. But providing a number of services to, again, help them to stay in their homes as long as reasonably possible, because we know that that's where they thrive the best at. And especially now, again, I'm just trying to keep them as safe as possible too, as long as reasonably possible. In our area, we have, again, one of 13 villages in the DC area. Our village services a community, as you mentioned, Nancy, in the Anacostia area, east of the Anacostia River, primarily African American. The village movement has not really spread in terms of equity into communities of color. We're probably the first one that serves primarily community of color, and we just launched an initiative to really kind of expand that into a few other communities. So we have been working really, really hard to just make sure we are not social workers, we're not doctors, we don't do that level of care, but we provide resources, we provide support, we provide referrals, we do a lot of different things with the seniors to keep them active, keep their minds engaged, connections with a number of opportunities again for activities and engagement.
Thank you, Kathy. Now, continuing moving south and west, Chris, what is aging in place to you? But I think also letting people know about how aging in place is part of what Habitat does, because our picture of Habitat is building new houses, and maybe we don't associate it with aging so much. But I've worked with you on other projects, and it is extraordinary what you do, really having to do with the place in aging in place, the home, and also the larger community. So tell us a bit about it.
Yeah, absolutely. Well, welcome to the South in Memphis. To piggyback off of what everyone said, it is about aging in place as an individual, but as a family and as a community. Greater Memphis has expanded that concept to include the county and the rest of the state. We have built affordable mortgages, led by home ownership, with over 575 folks in Memphis for the last 40 years. But when we saw that aging Tennesseans are about to be the fastest growing age group in the housing industry, we just had to adapt. We had to change with those changing tides. And so we needed to provide additional housing programs, which focused on not just the older adult, but older housing stock. So we focused on critical repairs. We focused on accessibility modifications. And then we're trying to expand that aging in place concept to tertiary community measurements and into state levels to address overall health and safety for residents across the state. But for us, aging in place really is about providing those critical repairs that keeps them in the home, and then those accessibility modifications that really can prevent a person from going into an emergency department with a slip or a fall or a nursing home, because it is so important for them to stay in their communities. We work with a lot of other researchers to kind of look at the impact that we're having, not just at the family level, like I said, but also within the community as well. And a great deal of that is ethnographic, it's storytelling, it's narratives, but it's also about looking at statistical analyses of healthcare data, emergency department utilization, things like that, because those are the types of conversations that our funders want to know, our foundations, and those folks who do commit their dollars to us each year. We don't just work in Tennessee. Like I said, we work across the state. To really provide those other kind of support and wraparound services and referral agencies. We've turned about 3.9 million into 26 million of socioeconomic impacts. And I always say, if we're lucky if we age, we're lucky if we age with our home. We want to make that an equitable opportunity for as many people as we possibly can. And being able to kind of expand that older adult service outside of the new home build and sort of the vision that folks get with Habitat has been tremendous in being able to address some healthcare considerations for folks in Memphis.
Thank you, Chris. That some of the points that you make about turning investments into impacts, that's really interesting, because there's always a conversation about, well, what gets people behind aging in place, what gets people behind building new housing, which we're going to talk a bit about later. And that's interesting how you've taken this long-term research approach to say, we start with this money and we're able to quantify it, because that's always a challenge is, who responds to stories and who responds to data. And it's a mix of both. So that's really fascinating. So I'm going to ask all of you to go back, because the report that Jen and Bailey and I have released had to do with the COVID moment. And, so much of what we've learned about this pandemic has had to do with its impacts on older adults, the population that constituted 90% of COVID deaths, a strongly age-associated virus. And a lot of our picture of older adults during the pandemic was about hospitals and nursing homes. But of course, we know that older adults were being told stay at home. And so what we endeavored to look at in our report with our network and other informants was to say what was happening at home and what was happening in communities. How did people respond locally to the needs of people at home? So I'd like to ask each of you, how did your organization pivot to respond to the needs of older adults at home? And at a time when, say, maybe some of the familiar places like senior centers and others were closed. What innovations came out of this response that you want to hang on to, that you want to study and perhaps carry forward, things you would do differently? So Ilana, go right ahead.
Yeah, so I'll highlight the case study that we included in the report, which was we were approached by a funder, by the New York Health Foundation. They said, we want to help older adults in New York. What can you do? And we will pay you to do it. And so what we decided to do was to bring together what are called age-friendly neighborhood organizations, which are grassroots groups made up of volunteer older adults who are exclusively focused on making their neighborhoods more age-friendly and better places to age in place. So we brought together about 15 or 20 of those organizations across New York City. The leaders of those organizations, again, almost exclusively volunteer, along with some nonprofit organizations and elected officials who have similar interests, to come together on a monthly basis on this platform on Zoom to just talk, to really share ideas, share resources, complain, because obviously there was a lot of complaining and concerns that were shared among these different organizations and older adults. And it was always, the conversation topics were always around, how do we help our other older neighbors survive during this really tricky, challenging, and scary time? And that had to do with food access, with digital access, with social connection, with basic housing needs, with information. Where do we even know what's going on with the pandemic? Where do we even get our information with vaccines? And of course, in New York City, which is so diverse in so many ways, neighborhoods are also very diverse. Some neighborhoods in New York, let's say, have high population, for instance, in Chinatown. So how do you make sure that the older adults that live in Chinatown that are ethnically Chinese, that they're getting the information they need in a language that they feel most comfortable in? So those were all the kinds of questions we talked about, and we really tried to also make sure elected officials were coming to our meetings so they heard directly from the voices and not just from the professionals about what the urgent needs of older adults were during that time. And the other really nice thing we were able to do with the funding was to give out grants to these organizations to directly address different COVID-related needs. So the grants were no more than $3,000. But they really, for example, paid for tablets for older adults, let's say in Chinatown, or they were able to share their newsletter with 300 more people in order to kind of reach more older adults. So that group is still going. We have a meeting actually this afternoon. We're still meeting on a monthly basis.
Great. Oh, you've put together so many different pieces. First, a foundation. Was it the New York Community
New York
Trust?
Health Foundation and then the New York Community Trust. Yep.
Both, yes.
Mm-hmm.
So you, a statewide foundation and a city foundation, both responding to you as a major convener, then you reaching out to all the neighborhood organizations and the policymakers, the elected officials, to make sure that they were hearing from what was going on in different parts of town. Julia, how did that work? You're in a foundation that had to respond. What happened across the river in New Jersey?
So, I can talk a little bit about what our foundation did in terms of, being more flexible with timing on grants and checking in with our grantees to see what it was they needed. But the more important thing, I think, is what they were doing. And, of course, we continue to support what they were doing. But I think that something that Ilana pointed out is really important to take a minute to think about. And that is that the things that she mentioned relied upon the foundations that had been built earlier with the age-friendly community work. And I think that those partnerships and those, individual leadership skills that were developed in the prior years while people were launching their age-friendly work really came to bear on the success, the effectiveness, the quickness to respond during COVID. We had a couple of other nice examples that people put together, the partners in their communities, such as there's a community in Bergen County that's called Garfield. Their center of activity had always been sort of in the older adult housing, the subsidized housing in Garfield. And so what they did was they called on their partners at the YMCA who conducted exercise classes to come and stand in the parking lot outside the building so that people could either be at their windows or on their balconies doing exercises together, led by a person who they knew and trusted and had been partners with, but had been used to going to the Y to do these things. So, you know, in addition to the kinds of things like drive-by food pickups and, you know, food pantries, partnering with age-friendly communities, there were other things that I think really helped them respond a lot more quickly and on a personal, kind of local personal level, based on the partnerships they had developed over the previous years.
Thank you, Julia. Now, what about Kathy? What about in Washington and in Anacostia specifically?
Pretty much some of the same. Our major pivot was to really focus more personally on the needs of individual seniors, because many of them were home alone, did not have spouses or family members living with them. So we had to increase that. I heard someone say earlier, those wellness checks became a major part of what we were doing. We went from maybe 30 to 40 a month to sometimes 100, 200 a month. Those calls or those drive-bys 3 and 4 times. Food insecurity was another issue for us during that time. So just making sure that we had volunteers and our team, our staff was able to pick up those items and deliver. Seniors that may have been home, again, unable to prepare their own meals, delivering home prepared meals and making sure we knew who was where and what their needs were. So we had to really focus more on individual needs than we had done before. And I think someone mentioned too also that the digital divide was major for us. So many seniors did not, number one, have access, but then if they did, many were uncomfortable, didn't have the tools, didn't have the devices, and trying to still connect with them and keep activities going. And so that was another major challenge for us. But we were able, I think, to be pretty successful. As Julia said, those partnerships that we already had were so helpful. We had a foundation that was helping us some too, the Washington Home Foundation, and they began to unrestrict funds and allow us to do a little bit more, some flexibility, work with the DC Department of Aging and Community Living. They actually increased a bit of their funding to the DC villages because, again, we were the ones on the ground really working one-on-one with the seniors. So those relationships and partnerships certainly helped us a lot.
Thank you, Kathy. So we're seeing some common threads here about existing partnerships intensifying in importance, not having to look around to figure out who you're going to work with. We had some interesting examples in our report of people both relying on their existing partnerships and networks, but then having to quickly make new partnerships. For example, a restaurant may have been closed, but it meant they had a commercial kitchen. So if you were doing food delivery for people who might normally have gone to a community center for lunch, you made a partnership with that person. But there was this trustworthiness that had to be there to say, you know, who can we work with locally? Will they show up every single day? Chris, what about in Memphis? How did that COVID moment take shape?
So navigating the pandemic was really challenging because we were working with vulnerable populations in metro areas, but in rural areas. And Tennessee has a tremendous rural population that other affiliates were serving as well. We applied for dollars that helped us level up on our protective gear. That way we could continue to do scope signing and paperwork to keep the exterior housework going on senior citizens' homes. Now, we weren't able to go into the home for social distancing measures, but we kept that exterior work going. And that was tremendous for us to be able to continue that. It was difficult not to provide repairs and modifications in the home because we see aging in place as being a cumulative impact where we're doing interior and exterior work. But what we did find doing surveys with clients who had received repairs and modifications prior to the pandemic starting, provided me with some incredible insights. Because of the repairs and modifications, their homes were safe and comfortable places to socially distance when the rest of the nation was telling them to lock down and stay in their home. So they had a safe, comfortable place to lock down. Many of them shared with me that if they had not had those repairs and critical modifications, that their home would not have been a safe place for them to be. They would have feared slips and falls. There was one client who shared with me that the leaks in her roof was so significant that she was pretty much having respiratory trauma weekly and going to the emergency department. So I got to capture sort of this longitudinal effort that when the pandemic did hit us, there were so many benefits of families being able to stay in their homes safely. We had a tremendous amount of support from wraparound services in metro areas that were helping us get food insecure individuals some support. Now, the outside grab bars that we put into a lot of homes and the porch updates allowed for folks to continue their socialization, yard visits, to come up and down those steps with the assistance of a handrail so they could have groceries, things like that. But it was still very difficult to not be able to kind of address some of the interior work. But we were able to follow up and continue that work afterwards. There was concern that with the rural areas, they had been hit so hard with hospitals leaving the area, other types of municipal support leaving the areas. So it was very difficult for a lot of those rural affiliates to continue the work. And so it was, very telling to see sort of what resources were available for wraparound services as we move forward. The metro areas reacted tremendously to, I think, the need to do a lot of socialization. And so we leaned a great deal on that to make sure that the seniors were getting that type of support. But we found that ultimately, whether it's the pandemic or just time spent at home, that these types of modifications made a significant difference for their healthy home experience.
Thank you, Chris. Now, Ilana has to leave very shortly, so I'm going to ask her the next question. And Ilana, whenever you have to leave, that's quite fine. You've all talked about how your organizations are part of partnerships and networks and made it very clear that nobody does this alone. Other approaches to aging in place, such as the capable approach to home healthcare, have networks that include multiple project sites. So they create their own networks as well as local partners. Habitat has a global network. So looking ahead from this pandemic experience, which is still continuing, but as we go forward, can you tell us what you're excited about? It's perfectly fine to brag. If it's a new program of yours, something that you're doing that you're thinking, this is the thing that gets me out of bed in the morning.
So I would say our networks that I just mentioned, our age-friendly neighborhood organization convening is exactly that. And we are continuing that and plan to continue that in perpetuity. I think we were certainly at the New York Academy of Medicine, part of a number of different New York City and New York State networks. I think this upcoming, we haven't talked about it yet, but this upcoming master plan for aging, that's kind of like slowly, in a good way, spreading and infiltrating the country, starting in California, is actually going to be a very exciting way of bringing together the aging networks writ large in every state, hopefully, and hopefully in New York very soon, to really bring together an interdisciplinary approach to planning for older adults state by state. So we are very excited about that at NIAM, and what we're talking about today in terms of aging in place is going to be very key to every master plan for aging. And I think just one other thing I'll just mention is that one thing that was just really, I think, good, really kind of exciting that came out of this was that so many different partners came together in a very non-competitive way. We all needed each other. We all needed to help and to share. And we were, oftentimes, understandably, nonprofit organizations in particular are going after the same limited dollars and kind of sometimes targeting the same populations. And what I really found, at least in New York City, was that we just came together and we were all just like, for the most part, how can we help you and how can you help us? And it seems like that attitude has continued.
Thank you, Alana. That's very hopeful in these times, you know, to just, as a resident of New York City, to see that, to hear about this, that this energy is continuing. And I'm always interested to know, like, how typical people, maybe who are not aging, can tap into this. So if, you know, if anyone wants to drop links in, this is a thing I've talked about, this is a way to get in touch. Please feel free to do that, or just follow up with us afterwards, and we'll be happy to provide them if you get super excited by something. Kathy, what about in Washington, or specifically in Anacostia? What are the things that, as we transition from the acute stage of COVID, knowing that it's still with us, health disparities are still with us, many challenges, what are you excited about or hopeful about?
What I'm most excited about at this right now is that because, again, many seniors in the DC area had not been exposed to the village concept and didn't have that support mechanism, that I worked with the other 13 villages. We wanted to address this whole issue of diversity and equity and inclusion. And so I developed a project called Age in Place DC. And we reached out into 8 additional communities. And I just shared a presentation on Monday. We reached 493 additional seniors with services, up to 1,078 services in a 9-month period. We were getting reports out from our, what we call ambassadors. We had ambassadors in all these neighborhoods, and they were servicing seniors in those neighborhoods, able to work with the Department of Aging to submit 89 referrals for things from home healthcare aides, the EPD waivers, safe at home, those home adaptations, home delivered meals, deep house cleaning, all kind of services. So I'm still excited because that was a pilot program for 9 months. We just finished that on the 30th of September. So I'm really still looking at the data and crunching it. Have gotten some funding. We're hoping to be able to continue it. So we're looking for additional funding so we can continue that program. But I'm most excited about that because we're able to reach more and more seniors because we still have the issue, as you said, of the pandemic and seniors being more vulnerable, and they're still not as apt to come out as many of us are. They still have some hesitancies. So just being able to continue that support has been really exciting for me.
Wow, that is really exciting. That's amazing how your organization, you know, went from, you know, being the village model, the one that was specifically serving Black communities, so that distinctiveness, but is now the center of this network of all of these other organizations. That's really something. And you raise a really good point about, you know, the vulnerability is still there, the age associated vulnerability around COVID itself. And as my mother, who's 88, would say, we're all 2 years older, you know, so people didn't say, oh, I'll just reset back to some earlier state of health. Right. Their Zoom works well for some people, to whether it's participating in a congregation or a book group or whatever it may be. And also some people have stopped driving and have just said, well, now I'm really seeing how difficult it is to get around my community because we don't see public transportation or transport services of other kinds. Chris, could you tell us what gets you out of bed in the morning, and also what's going on within the greater Memphis area that are sort of continuing challenges as well?
Yeah, so none of us can do this work in a silo, and every habitat is different depending on what the geographical and cultural needs are for that particular area. We work with funders and these epicenters of cool researchers who are innovative and compassionate to look at how we're making a difference for older adults and their families and the communities where they live, because we're all so different. And evaluation really matters when we're validating funding and we're seeking more funding and sustaining the funding so that we continue to adapt to the older adult needs, right? Because what was the need 2 years ago is going to be different now, and it's just going to continue to change. It's not the same for all rural areas in Tennessee, but Memphis is working with Green and Healthy Homes Initiative to look at medical data. We work with medical education departments at the university, and we look at our city leadership for funding and showing up at city council and county commissions so that we're getting as many federal dollars as possible trickling down so that we can continue to do that work. We have a social worker on staff who is tremendous at helping us sustain that work. I think kind of like my grown-up Christmas wish and my next vision for where this work could go is that we work with hospitals and managed care organizations to fund the work so that one day a doctor can write a prescription for a critical home repair or an accessibility modification. Habitat or an agency like ours can go in, do the work. We can work with an occupational therapist or a physical therapist to, get that older adult working on the ramp and using it safely. And then at the end of the day, the managed care organization and the healthcare industry is funding that. And investing in these types of interventions prevents frequent use of the emergency department. It prevents premature entry into nursing homes. And each year, our program across the state of Tennessee saves about 2.8 million in nursing home savings that would have otherwise been falling on tax-funded Medicare systems. So it's important for us to talk about the dollars of it, but it's also important for us to talk about who we are engaging with genuinely and authentically so that we can make sense of all these different changes and we're doing it together, because a savings isn't just a savings for an MCO, but it's a savings for that individual. Mm-hmm. We're also looking at utility cost savings as well and working with utility companies because that's huge and that's significant.
Thank you, Chris. You're so good at bringing all of these different things together, but both the data when you can get to hard data on the payoff of investing in housing, but also to the fact that the stories matter, the experiences matter. Every home you go into is someone's home, and it might be someone's whole world, because we know that most of the experience of late life happens in your home or close to your home. So hence the focus on neighborhoods and walkability and green space and all of these different things. So Julia, what are the things that you're excited about? And I know you have something you want to show us. So
I do have something I want to show us, but I have a couple of other points I want to make sure I connect with. So first of all, Kristen, I just want to say thank you to your Habitat for Humanity and others that are like yours that are really expanding what they're working on and what they consider to be, in response to the growing aging population, what you consider to be important. And it's so true that those kinds of renovations and improvements to the home make a world of difference to how long a person can stay, and remain in their home more years. So thank you for that good work. And same to you, Kathy, for expanding what you were doing just beyond your circle of original success, I'll call it, to allow, more and more people to participate in that and benefit from it. So yeah, I could say something about, our work and our partnerships that have influenced state government, processes and partnered with state government, also with county government and local. But before I do that, I just wanted to give a shout out to our colleagues at Rutgers University School of Social Work. We have really strong partnerships with their team led by Dr. Emily Greenfield. And we couldn't really have made the progress that we've made with our age-friendly communities without their sort of skill set and ability to give us structure to our work. They bring together the grantees and participants and interested parties from around the state on a monthly basis and plan very meaningful meetings together so that we can learn together. It's just a big active hub of learning. And we are really fortunate to have them interested in this work and continuing to partner with us on it. So I just wanted to make that point, because I think, giving a spark, using some grant funding to pilot some ideas, getting things going, and then sort of that slow burn and that continuous set of, ambers, if you like the fire analogy, to embers to keep the work going and keep people motivated is really important. So they have played a significant role in helping us do that in our state. But we are lucky that the state of New Jersey determined that they would like to be a part of this age-friendly movement and joined the age-friendly communities network that AARP has offered people to join, and states and counties have joined that. So our governor decided that he would put together an advisory council, and some of the members of our original age-friendly communities in northern New Jersey are part of that council. So we feel like that's a great way to have liaisons with what's going on at the state level, and communicate back and forth with local communities for what's going on at the state level, and inform them about the blueprint they're trying to come up with. I agree with Ilana that sort of the next logical, most sensitive step is like a master plan for aging. And I'm hoping that New Jersey will also embark on a learning process to participate in that as well. Some kind of a more comprehensive plan that can work both from the state level down to the county and local, and in the other direction as well for informing that blueprint. But I did have a specific example that I feel like is inspiring to share from one of our local age-friendly communities. The one that's in Teaneck has been working on this, implementing the model of age-friendly work for 6 years. And because of the advocacy and the awareness building that they've done over those 6 years, they were, and the skill level of the people who are leading the effort, they were able to coordinate with their city government to really actually put new housing in place in Teaneck. I'll share my screen with you to show you what it looks like, because they're coming up on their groundbreaking for this event, and it's very exciting. Can you see that?
Great.
Yeah, it's you know, the culmination of a lot of work went into this, and the experience of the age-friendly leaders, and that, like I said, their advocacy over the years for the need for this really helped convince the town that they would be good partners. And the other thing that I think was very influential and an incentive to the township was that they knew that the age-friendly group was committed to creating a community center on the ground floor of that building, then where they would have like an age-friendly hub. And that was very encouraging to the township and a selling point for partnering.
Well, this is truly inspiring to see. Thank you so much for sharing this, Julia. I note that it is 100% affordable. So that, and this is in a county that is right across the bridge where, you know, that I look out, that has does not have a lot of affordable housing. And, you know, and there has, and, you know, you have single family homes. It's many communities are very, very desirable. It's the New York area, blah, all of those things.
Yes.
And the fact that the town came together with developers, care services, and the town itself to realize this need to help people age in a place while insulated from rising costs by, you know, being very clear about how much money people have. Jen Malinsky's quantitative research has talked about the fact that the typical older American is not wealthy. The typical older American has difficulty paying for both their housing and their care. So when you see cost of living increases, and imagine how difficult they are for a person who is in the workforce, imagine somebody who isn't in the workforce. There's no easy way to earn more money to deal with things. And so that you've taken this on is absolutely wonderful. And it also reminds us that the only way to respond to affordable housing isn't by saying not in my backyard. It's a town saying yes to it. There is even an acronym, YIMBY, yes in my backyard, because it isn't really my backyard. It's not my personal backyard that I own. It's the place itself. It's the town itself.
That's
so
right.
That's just wonderful.
And Nancy, they just to, sorry to interrupt you, but
go ahead.
That's a good point. That it took a long time to get to this point. There were housing facilities that this community leader has been involved in before this one. This one went much smoother because of the NIMBYism in the first case and the political will of that community and many communities in New Jersey against, you know, anything that's not single family homes. And so they had to fight against that and advocate for it. And they're going to be staying on top of things in terms of sharing, educating the local community about the availability of this these affordable units, because sometimes in the past, the local community that surrounds this neighborhood that would be the most logical and most likely to want to live there somehow get pushed out by other people, you know, other people that come in from other places. There's such a high need that's inevitable. But they want to work very hard to make sure that local people know about this in time to apply, if they're interested. And that's another step along the way that they have learned by listening to the community and hearing what it is they need. So yeah, that was very important. And they're all going to be, like it says here, 100% affordable and based on income, anywhere from, I think the 1-bedrooms are like $460 up to $1,300 a month, depending on income. And the
Wow.
2-bedrooms are $550 a month. I'm looking at my notes, to about $1,600 a month, again, depending on income.
That's really magnificent. And I think, the fact that people from other towns are going to be very interested in this is a reminder that really every town needs this.
Yes.
Needs the logical place, because not everybody can age safely, comfortably, affordably in the place where they live right now. But staying in the same place where all of your social ties are, the pharmacy, the library, everything, that is deeply meaningful to people. So that's great. It's wonderful to have a story like that. So, this has been really exciting hearing about all of these great things. So before we go to the wonderful questions we're getting, I would just love to hear from each of you about what is the one thing about aging in place that you wish policymakers, members of the public, reporters, you can take it as you see fit, people who make policy, people who debate whether something is desirable in their community, what you wish they got about it. We know now that aging in place is not a solo project. It involves what is going on in your community. It very frequently involves another person in your family who is often a family member. And it is not just something that wealthy people should get to do. So what's the thing that you would love to get across that you just don't see when people talk about this issue? And I'll ask Chris to go first.
So I guess another grown-up Christmas wish, coming your way. I think that there will be mass disparity and mass inequity coming down the pipeline as people age, and being able to provide funding, culturally relevant services and programs for every single human is going to be pivotal. And it is not just the humane and kind and empathetic thing to do, but these are individuals who have paid their taxes their whole lives. They have worked, they have contributed to communities, and they are special and significant assets in the neighborhood. And so my kind of call to action for everyone is to look at the types of funding that can come down the pipeline that could serve individuals and decrease those acts of disparity, so that folks are aging in place as fairly and justly as possible, and paying attention to pieces of legislation that helps knock out any kind of challenges or barriers that could affect people differently. And I think too, just making sure that we're honoring that cultural and significant aspect of grandkids connecting to grandparents, that when we serve older adults, we're not helping just one generation. We are serving those individuals who are having kind of intergenerational connections, Christmas, holiday, Sundays, neighborhood association meetings, and things like that. It's not just one generation we're serving, it's multiple when we focus on older adults.
Thank you, Chris. Kathy, what's the thing you would love to get across?
I echo so much of what Kristen said. I love to tell people that seniors not only deserve the resources, they've earned the resources, and things change over time. A senior shouldn't have to be concerned about a wheelchair or medicine or getting a ride to a doctor. So all the things that concern them and worry them should be automatically there through policy, through funders, whatever it may be, that those who are able to provide those services can. So that's it for me, just making sure that we're able to provide whatever resources those are. And as Kristen said, looking at it from an equitable standpoint, racial diversity, whatever it is, they're human beings, they're people, they're valued, and we need to just make sure that they're well taken care of. And so that's the message I would leave.
Thank you, Kathy. And Julia, what would be the thing you'd like to get across?
It's hard to pinpoint it, but I think about our caring professionals. And I think it fits into, the bigger picture of what Kristen's saying. At this conference I just attended, Grant Makers in Aging, one of the elected a representative who was there, who was an elected official, was saying that, it seems that when the federal government puts a priority out there, they find money for it. It can be rearranged, rebalanced from somewhere else, or assigned to different kinds of priorities. And I just think that we as a society need to think about how we want to live our lives, the whole entire life, from cradle to grave, and how we want to have access to the kinds of things we need. And I think people who've worked really hard all their lives and paid into a retirement fund and then find themselves having spent that money well before the end of their life need to have the options and the care provided by our society and our culture that will, like Kathy and Kristen said, equitably allow all of us to have access to a good quality of life as we age. And Medicare and Medicaid there are a lot of legislative decisions that need to be made to make that happen. Reimbursement levels for caregivers and for family caregiving and for the whole direct care workforce need to be re-examined and carefully tracked. And we have that's one of the populations, the one that's providing the care, that is also aging. And most of them don't make a living wage, and they don't have they themselves need access to subsidies. So it's not a society that you can feel proud of when we're not providing for people throughout the lifespan.
Thank you, Julia. I'm so glad you linked up the issue of care and caregiving with aging in place. And I was just about to turn to this because there's a question from our audience as well. When we had our launch webinar 2 weeks ago, Robin Lipson, who oversees elder affairs for the Commonwealth of Massachusetts, that was her big point. One was digital equity, the idea that we have to think about internet access as something like water or electricity or heat, and make sure it's available to everyone and isn't sort of an amenity. But the other point was that we have to remember that when we imagine a person aging in place, we almost always have to imagine that caregiver, who is often a daughter or sometimes a same age spouse, who is making this possible, so that we're not saying, oh, this is a solo project and this person is somehow perfectly healthy and has all the money that they need. That caregiver may be managing things, maybe the driver, maybe doing the shopping, maybe the IT person, because if you're out of the workforce, you don't have like some colleague you can just email when you need help with Zoom or whatever it may be. Many, many other things. And for a person who is reasonably healthy, sometimes I think we hear the word care and we think we mean 24/7 care or nursing home care. It's like, no, all of this is part of care, is part of what we do for others, but also what we, as Julia alluded to, what we do for our society, when we are members of an aging society, how we are good citizens to our fellow members of our society who are aging. So how do we hold these issues together? Because we do have a habit in this country of thinking about issues having to do with one's home as private issues. My home is my castle, as though it's only about like how you decorate your house or things like that, or what color you paint it. But there's could be this idea, well, it was your responsibility to have earned enough money to afford what you need. Now, if we had a group of economists, they would talk about, well, people's pensions have declined. If you're a woman who's in your 80s right now, you may never have been in the workforce, or you had a limited access unless you married someone who's wealthy. You didn't necessarily have control over how much money you had. So how do we answer those questions, that this is your responsibility, and think of this as this is a societal responsibility because population aging happens at the societal level? I'd love your takes on this, especially with the focus on the responsibility of that caregiver, that person we're thinking of who's in the picture. Anyone who'd like to have at it first?
I'm happy to jump in. I am almost 40 and I am helping my mother who has early Alzheimer's. And I have on different occasions had to call into work I've had to call into work to help my mom with doctor's appointments and helping her advocate for herself in medical realms. And so if my mother and I are a small case study of what could be happening across the United States, I'm thinking about these corporate level considerations where they are looking at their own staff and they are looking at their employees, and they're going to see those adult children stepping aside to maybe have to assist their older adult parents. And that is going to be something that we need to be thinking about, because if all these older adults are aging at unprecedented rates compared to US trends, then those adult children are going to be chasing after their parents trying to help them, and that is going to affect their ability to take care of their children. It's going to affect their ability to consistently show up at work, and it will also affect their health. And so it's not just this, we're serving older adults and their adult children. And we're creating a safer, healthier place to socialize between grandparents and those grandchildren. So it's very much something that should be on the radar for large corporations. It's something that should be on the radar for government at city and local levels, state, and even federal levels, because these are all things that will matter, because human behavior does what it does best, and that is sneak up on you. And so one of the things that I've tried to tackle is talking to the adult children and asking them what their experiences have been with stepping in and assisting their families, either because they're in a rural area and there are no other services, or because that is just how the setup is for that family. Medicare is confusing to navigate. Recapture policies related to housing assistance is difficult to navigate. So being able to start with having those narrative conversations with those adult children who are helping and being the caretaker is going to really shine some light on the types of programming that maybe Habitat can either refer out or we can fold into our own kind of mission. So it really does go back to talking to the folks who love and care for these older adults and and then the older adults telling us what they think. So it really goes back to research, which is kind of my thing, but it has been very, very helpful just to see and hear those stories.
Chris, I'm so glad you mentioned this, as in terms of research, the idea of being socially engaged means, and especially around equity issues, means learning from the people you're trying to serve and helping them to be part of what you're trying to study. I also like the fact that it gets off us up the idea that we have to think of caregivers as people we should, care for or feel sorry for. Oh, that sounds really difficult, but not really actually do anything for. So if this is such a broad part of our society, and we know it happens at the beginning of life too, thinking about how we care as a society for all the people in our society is going to take research. It's going to take reframing, a lot of different things. Julia, Kathy, any other points on this in our final minutes?
I will just say that Chris, and I, like you, I'm a caregiver for my parents. And if it weren't for the fact that I'm working from home remotely, I would have also had to call in many days, because I do arrange a lot of doctor's visits and caregiving. What I wanted to say was that luckily for us in the area of the country where we live, we have a lot of services that can be delivered at home. There are emergency care organizations that will come to the house. There are organizations that can give the vaccines in the house, that can, besides the traditional delivery of food and those things, come inside and do an x-ray if somebody falls and you think a rib might be cracked or something like that. We've had all of those things done in our home. And my parents have good insurance, which covers all of that. I think that should be just the norm. I don't think this should be a special story that people are saying, wow, that's really great. I think that should just be the default. And I hope we can get to that point. I know Medicare and Medicaid have an imbalance between the money they spend on people in institutions versus in the community. And they're trying to look at that and rebalance it. And I think that's going to be a key place to begin with changing this process.
And I agree, and I think it is incumbent upon organizations and communities, to understand the challenges that we're facing and be committed to doing what we can to provide those services. If we're not providing them directly, to make sure that seniors know the services exist and that we can be a referral or a navigator or whatever that is, that they're getting what they need. And in the community that we live in, a lot of the services are available. Seniors don't know about them, don't know how to access them. We did a lot of calls for COVID vaccines and getting people on the schedules and, PPE, these things that people did not know how to do for themselves or didn't have people to do it for them. So I think, again, for organizations also and just individuals to step up and really get involved to help us to advocate and support the senior community.
Thank you, Kathy. We are at time. We could keep going, but the conversation will continue in various different forms, including on November 8th and November 18th and December 8th, when our next two webinars will be held. And we will drop those links in the chat so that you can continue these conversations that we're having. November 18th, we're going to be focusing on housing specifically and lessons from COVID and lessons for the housing community going forward. Jen Malinsky will host that at the Harvard Joint Center for Housing Studies. And then Jen and I will do the final webinar on December 8th, when we're going to talk more about how do we take the insights from practice and get it to better big public stories about the change we need. How do we not only imagine the society we want, but actively work toward it in under real world conditions? So this is very exciting fall ahead. Thank you so much. Thank you to Jen and Bailey and Ashna behind the scenes. And I hope you all have a wonderful day. Take care.
Thank you.
And as a reminder, a recording will be made available later today at www.thehastingscenter.org. So thank you all again.